this is Dr. Shirley. I'm a pediatric dentist working here in Pearl Dental Clinic, Dubai. So we are here going live on one of the most frequently asked questions to me, which is why is baby tooth important and what are we supposed to do? So this is one of my favorite questions that's being asked very frequently. Today we'll discuss about that. Before we go into the topic, I'll just give a brief explanation about myself. So I am Dr. Shirley, as I told you, and I've completed my course on pediatric dentistry, masters in pediatric dentistry from India, and I have this passion towards treating children, adolescents, and especially children with special needs. So this is my interest. It's because I have an empathy towards children and how they are and how helpless they are sometimes when they have pain, when they need us, when they need help, and we are right there to help them. So with all of their dental issues, you can always rely on us, okay? So before we go into the topic as such, I'll have to tell you something about baby tooth. So babies, when they are not born with teeth. You all know that. In rare cases, yes, they are born with teeth, which will be a separate topic on its own. And if that's the case, it will be taken care at the hospital where they are being born. And usually they don't cause any threat, so you don't have to worry about that also. And very commonly, we get the first milk tooth out at 6 months of age. So that's the most common period where the first tooth erupts, and it's mostly the lower front tooth. This is for your information. And how can you even come to know that the tooth is coming out? So a normal, happy, well-behaved baby suddenly starts to behave cranky, is a little irritable, starts to drool over, is not taking food like before, there's a loss of appetite, and this all can be some cues. So the parent, especially the mother, can look into the baby's mouth, look for these tiny, pearly, white structures appearing on the lower jaw. So if that is the case, then congratulations, your baby's getting their first tooth. So that is a very precious, moment. As precious as it is, you have to be taking care of that tooth very well. That's because there's a lot of, usefulness to the baby tooth. One main thing is that as a tooth starts to come out, there's an indication that they are ready for solid foods. So, an increase in nutrition, increase in growth, there are a lot of benefits out of what is going to happen in future. So when the tooth is coming out, the child is naturally going to be a little irritable. So how can you go about with it? We call it teething, you all know that. So how do you manage teething problems in a child? Generally, the gums around the teeth that is emerging will be a little swollen, will be a little red, and they'll have trouble feeding. So if that's the case, you just have to offer a cool, wet washcloth or a cooled teether. So don't please give the frozen teether. There are a lot of teethers available in the market. Just keep it in the fridge, make it cool, give it to them. If they bite onto it, it has that soothing effect on the gums. So that can be a real relief for the baby. So that is one thing. And if the child is really in pain, you can always go for an over-the-counter medication like a Tylenol or something, or you can always, refer them to us and we are there to help you. So that is another thing. So as the baby is growing, you're going to have all the milk tooth come out. By the age of 2.5 to 3 years, the full set of milk tooth is there in the baby's mouth. Now this is a very crucial period. Now you have to take care of the baby's mouth right from the beginning, right from when they are born. How do you do that? It's with wet gauze. You just wrap it around your fingers, or a clean finger, with a clean finger or a clean cloth, just wrap it around your finger and run the finger around the jaws or on the palate, the sides, the cheeks, the tongue. That's how you clean a baby's mouth when there is no teeth. This is before 6 months. And once the first teeth erupts, what you're supposed to do is you can start using a toothbrush, soft bristles or a silicone bristles toothbrush, a small head in size, And you can start using toothpaste. Now this is another very frequently asked question to me. When can you start using toothpaste and toothbrushes? From the very first tooth, when it erupts into the oral cavity, you can start using them. But the size or the amount of toothpaste used should be as small as a size of a grain of rice. That small quantity has to be used. Now just take that small quantity, apply it on the toothbrush like a smear layer, and start cleaning the teeth. How do you have to do that? Go in small circular motion on the tooth surface. Now please don't scrub the teeth, as they are going to damage the tooth structure as well as the tender gums. Now, this advice also goes for you adults or parents as you watch it. Never scrub, never go like this right and left. In that way you're damaging, you're doing more harm than good. You're actually hurting the gums, which are very soft. How you're supposed to do that is go round and round, small circular motions. Children, as they grow, they become more used to these motions, and they quickly learn these small motions. Okay, that's how we do it. And so again, coming back, that's how you clean the teeth. So by 2.5 to 3 years, they'll start to learn to spit. Now you have to encourage your child to spit. Now all of this has to be supervised by an adult. If not, a child, as they grow, if you just give it to them and you don't attend to it, there is a chance they can swallow it, which can be harmful. So always have an eye on your baby, on your child as they brush the teeth, and always have that in mind that they should not be swallowing it. They have to spit it out. Okay. And what kind of toothpaste can I use, doctor? This is another common question that is been posed to me. Now, before the age of 3 years, we generally recommend non-fluoridated toothpastes. Now, the ones we commercially get is mostly fluoridated. That is very good, but kids who are less than 3 years, not necessary or not needed. Okay, you can always go for a non-fluoridated toothpaste, which is now available in many pharmacies. You can go for it. Just apply that very small amount. And as the child goes, you can increase the size to a small pea-sized toothpaste. Okay, you can take that, smear it on the toothbrush, and offer it to your child. And they have to start using in small circular motions. So this period from the 6 months to 3 years is when you get the full set of milk tooth, and it is very crucial because your baby starts to have their different developmental milestones as they are born. As you enjoy each milestone, this is one of a very interesting milestone that the child has achieved, having all their teeth in their mouth. And it is up to us, the parents, to properly take care of them, because the milk tooth is the one that helps the child to chew, to eat, have the proper nutrition that is required for their body's growth. So when they don't have, or when it is diseased, when it is not healthy, they are going to be in pain, and they are not going to get the sufficient nutrition that they are supposed to get. So there can be a problem with the growth. There can be some cognitive developmental delays. So all of this can be minimized by properly taking care of your milk teeth. Another important function of milk tooth is speech. Now that is the age when your child starts to learn to speak. They start to express themselves. Now when they don't have this front teeth, the way they pronounce certain words can become difficult. You all would have seen when a child has difficulty in pronouncing certain words. And the front teeth, when it is not, which is missing, they really have that difficulty. Okay. Now another important function of milk tooth is aesthetics, social smile. When a child has healthy smile, they can smile a lot, they can make friends, they can be that happy, jolly type. That personality development is being they are growing in that way. So if they don't have that beautiful smile that they have, now that can be an issue. They start to become shy, they'll corner themselves, be in a very closed circle, they don't expose themselves out, they're not extroverted. So that again is in your hands. So when you don't take care of the teeth well, when they don't have this front teeth especially, that can be a problem in their personality development. So all of this, starts with a simple, a step from you, wherein you take good care of what is present, what you already have, the milk tooth. Okay. So another thing is, when you don't, go for a regular checkup to the dentist every 6 months, you can actually miss out on very important things like cavities. Especially in the milk tooth, it spreads very fast. You see a cavity today, in a month's end time, it is going to reach to the root, or it's going to cause pain. So every 6 months, please, you just bring your child, and we are there to help you out. We'll be able to tell you if there's any issue. And when should be the first dental visit? This is again another common question. The first dental checkup or the visit has to be when the first tooth erupts. This can be very early. Now you all will be surprised to know that 6 months, that is way too early. Now that is the right time to bring your child to a dentist. This is what the American Academy of Pediatrics actually recommends. So you have to bring your baby when the first teeth erupts. Now this is why we call you to the dental clinic, because we'll be able to see if there's any other defect, including the ones in the tongue, the cheeks, and everywhere in the jaws. If there's any other issue, we'll be able to notify you at that very early age. But never delay the first visit beyond the first birthday. That is what is recommended. Okay, so again, going back to the topic, what else can the milk tooth help in? The milk tooth is one very important thing that guides the eruption of the permanent tooth. If there is an infection in the milk tooth, it can be easily caught by the permanent tooth, because the permanent tooth lies right behind or at the back or underneath the milk tooth. So when this comes out, if the primary or the milk tooth stays there in its position, it's going to guide the eruption of the permanent tooth. And when it is not there, it is going to come right or left, front or back, and not in its place. So that's when you see all these crowded teeth, this crooked tooth, and that in future could lead to your child having brackets. So all of that becomes an extra expense for you. So all of this could be prevented at a very early age if you are cautious. Okay, so to guide the eruption of the permanent tooth, that is one main function. Also, if there is an infection on the milk tooth, it's going to be there in the whole oral cavity. It can be easily picked up, so you have to be really careful. And always, monitor your child, as in if the child has a discolored tooth, a hole, or the child is complaining of food lodgement, always check for such things. They can be, the first signs that there is something wrong going on with the tooth. Now, how can you really prevent all this from happening? First strategy is reduce the sugar intake for the baby, because sugars are one of the arch culprits, we call it, when they cause decay. So reduce the sugar intake as much as possible. Try to substitute them with other healthy food. Okay. The next thing is you can supplement your food. Also, there is another wonderful mineral that we have. We call it fluorides. That's totally different topic. I'll be covering it in another session. We have to increase the fluoride intake by the child. Now I'll talk a lot about that in the following sessions. And please have regular routine checkup with the dentist, so many of the problems can be avoided. So all of this can be done, and always look for any signs. Ask the child regularly, and installing this at a very early age can put a positive mindset in the child's mind. So even when they grow as an adult, they don't have problem visiting the dentist. They are always going to have healthy teeth. Okay, so that's it for today, and we hope you enjoyed the session. Please do like, share, and subscribe. And if you have any queries, please do leave it to us in the comments. We are so happy to answer every one of them. Okay, thank you.